Hi, I'm Norman Linzer, retired professor from the Wurzweiler School of Social Work of Yeshiva University, and I'll be moderating this webinar. Thank you for joining us at the Yad Sarah webinar. Yad Sarah is committed to increasing accessibility for the communities that it serves, such as medical equipment loans, transportation, therapeutic programming at day rehabilitation centers. Yad Sarah has helped hundreds of thousands of people access the health care that they need. I have two statistics for you. Cumulatively, in the past few years, 65,000 people have received home visits from Yad Sarah personnel. Secondly, these days, someone borrows a wheelchair from Yad Sarah every 15 minutes. So just indicates the need that it fulfills in the community. But there are major concerns facing accessibility today in the United States and in Israel. So the theme of this webinar is creating a more accessible new year. To address this topic, we have with us three panelists. The first is Ellen Abberbock, attorney, Nassau County Department of Social Services. The second panelist is Shani Rosenfeld, director of Yad Sarah's Exhibition and Guidance Center. And the third panelist is Elliot Sloyer, co-founder of Wheel It Forward, and he will tell you about that organization. So we will begin with a series of questions addressed to the panelists. After their presentations and their answers, you will get a response, an opportunity to respond from the floor, and questions and answers, questions could be submitted from you to the panelists. So we will begin with Ellen. And I'm going to ask the panelists the questions, and they will address these questions. First, tell us a bit about yourself and what you do.
So thank you, Dr. Linzer, and thank you, Yad Sarah, for inviting me for this webinar, the issue that's near and dear to me of accessibility. I'm currently an attorney with the Nassau County, New York Department of Social Services, where I serve as the Americans with Disabilities Act client coordinator. So for example, if we have a client who is applying for some benefits and has to bring in documentation, but what if they, because of a disability, can't get into the building? So we find other ways to get that information. Can they email it in? Can they fax it in? Can a worker of ours call them to get the needed information? I'm also on the board of the Long Island Center for Independent Living, which is a center and resource for people with disabilities in the community to help them achieve a better lifestyle and provide them with resources to stay in the community. And lastly, I serve as an impartial hearing officer to hear special education disputes between a special education student and the district, if indeed the district may not be providing the services needed by the special education student.
So it sounds like you have a full-time job.
Thank God, yes.
Okay, Shani?
I'm an occupational therapist, originally from Albany, New York. I've been in Israel for 38 years. I work for Yad Sarah in the Exhibition and Guidance Center, which is a model apartment that we have in Jerusalem, where we have smaller ones in other branches. We support and advise families and therapists and the community on which kind of equipment could be useful. We do a lot of in-service training with professionals. And we are sometimes pains in the neck to certain government offices and do a lot of counseling with families and other service providers so that people get what they need.
Great. Elliot?
Yes. Hi. I also wanted to thank Dr. Linzer and Adele Goldberg and everybody at Yad Sarah. So I'm Elliot. I worked on Wall Street for about 25 years. Since that time, I've been writing children's picture books. I published 2 books about my summer camp experiences at Camp Nassau. I volunteered until this COVID situation at Morgan Stanley Children's Hospital. I've biked across America with my son. I've biked halfway across America with my daughter. I was a co-founder of a startup that was sold in 2018. And in 2018, through a strange confluence of events, I chaperoned an 8th grade trip from the Bicultural Hebrew Academy to Israel. They've been running that trip for over 50 years. And it's kind of a crazy trip from both a child perspective and a chaperone perspective. It's a month long. We found ourselves at Yad Sarah about a week into the trip. And when I saw the presentation, which is just a world-class presentation, I said to myself, wow, this is just an incredible idea, an incredible concept. And to back that up, a week later, we were doing a hike in the Arbel area of Israel, which is in northern Israel. One of our students twisted her ankle towards the end of the day on that hike. We got back on the bus. We headed to the Golan Heights where our hotel is, which is in the middle of nowhere for anybody who's ever been there. We get off the bus, we walk into the hotel lobby, and sitting there in the hotel lobby is a wheelchair. And on the back of that wheelchair, it said Yad Sarah. And it was like, I don't know how that got there. We used that wheelchair for the next couple of weeks, schlepping it on the bus, off the bus. And then the question was, well, where are we going to return this wheelchair? And in Israel and at Yad Sarah, the answer is, well, you return it at the airport before you get onto the plane. And it was all free and it all worked. And that was my exposure to Yad Sarah. And it was an inspiration to me to come back to America to see what's going on in our blessed country, which perhaps I could talk about later.
Okay, fine. Thank you. Since the topic of this webinar deals with accessibility, what does accessibility mean to you?
So I like to think of accessibility as usability. Anything I need to get through my day should be usable by someone in a wheelchair, someone who has a vision impairment, someone who has a hearing impairment. So for example, if I want to get to work by using the public bus, that public bus should have a wheelchair lift to get me on. If during my lunch hour, I want to go out to lunch, the restaurant I want to go to should be wheelchair accessible, have a wheelchair accessible bathroom. If I'm taking a friend of mine who might have a vision impairment, there should either be a braille menu or a waiter or waitress available to read that menu. Everything should be usable by persons who have a disability. That's what it means. I think of it as usability. Can I use this item, place, restaurant, theater, sports stadium that I need to use?
So to you, does Yad Sarah provide this accessibility? So as you know?
Sure, their services in providing wheelchairs, medical equipment. When we're jumping the questions, but several years ago, I was in Israel. My parents let them rest or buried in Israel. And I made a trip. I'm a wheelchair user, and I made a trip to Israel. Yad Sarah made things much more usable to me by picking me up at the airport in a wheelchair accessible van. I stayed at a hotel, and they provided a hospital bed as well as a patient transfer lift. And they actually provided wheelchair van accessible to the cemetery so that I could view my parents' grave sites.
Thank you. Does anybody else want to respond to that question?
Sure, I'll say just a couple of words. So I obviously agree with everything that Ellen said. We at Forward are coming at this from kind of a more focused lens. And for us, accessibility means awareness of the places where people can borrow and or donate durable medical equipment that they no longer need. And what we have found by calling, many places across America is that people, there's no brand associated with this concept. And because of that, when people need things or when they have things that they no longer need, it's very hard for them to figure out and to scramble. How do I get a hospital bed? How do I get a wheelchair? And so one of the things that we're trying to do is not only start one of these, what we call lending library, but also to template it and to share eventually what we learn and how to do this with other places. Because if Ray Kroc had his McDonald's hamburger stand and never shared it anyplace, a huge opportunity would have been missed. And when you see what Yad Sarah has done in Israel, you realize that we here in America are just scratching the surface. And one statistic, Yad Sarah last year lent out over 300,000 pieces of durable medical equipment in Israel to rich people, poor people, Arabs, Jews, Christians. Our survey of durable medical equipment lending libraries, often called lending closets, which is a name we don't like because a closet by its nature is constrictive. We don't think that there's 300,000 items in all of the lending closets in America put together. And America is 40 times the population of Israel. So that's what we have found.
I'd like to add a few words,
Shani?
Dr. Linzer.
Shani?
First of all, you guys are
Yeah.
fascinating, and it's really a pleasure to be with you all. You're also telling our story, but it's interesting because we have done templating. I was in Odessa and Minsk, went through the joint Yad Sarah, helped open up service centers there under Russian programs.
Do the people speak
we
English?
did projects.
Because we'll take their help also. Do the people speak
yeah.
English? Okay.
Well, no, I had a translator with me the whole time that
Mhm.
was there. And I spoke Hebrew to some of the people there. It was interesting. We've done projects with other countries, Italy. We've done projects with Mexico, giving them the model of how we work. We opened up a center helping people in Uganda many years ago, taking old equipment and fixing it and having them make their own equipment. But I think the concept, and Ellen, I like that she used usability. I take accessibility, though, not just in the physical sense. I believe a lot in information is also a very important tool for living. So I take it as you should know how to get stuff, where you need to get stuff, and not just equipment. Understand how the services work. So it's the physical side. It's also for people with cognitive issues, people who speak different languages. I believe accessibility is not just in the early terms of wheelchairs. And I'll tell a very funny story. Someone came to me about 28 years ago. My sister wants to make Aliyah. She's from New York. She sits in a power wheelchair. She has polio. And my first response was, why would she want to come to Israel? You know how hard it is to get around the old city? Because it's really hard. Anyway, she ended up making Aliyah and was still a volunteer in the exhibition center and was very active in the early disability movements in New York, as well as in our independent living centers development. So we just think that the information, like you're talking about your library and wide services, is really, just regular living. That's what we want accessibility to be, the real world, and not just accessibility. And I have a booklet that just came out today. I don't know if you can see this picture. I get it from one of the accessibility centers. It talks about the project of how the old city became accessible and how we all went and marched all around it and mapped everything out, and how in Yad Sarah we even have had courses for tour guides on how to be a sensitive, accessible tour guide.
Thank you. Among the three of you, you've really demonstrated or shown how widely Yad Sarah reaches into so many different communities and so many different levels. Where did you find a lack of accessibility in your community? And what did you decide to do about that? Elliot, what struck you most when you visited Yad Sarah for the first time? And how did that motivate you to start your own lending center? Wheel it forward.
Sure. So I've always been the fan of the library, having published a couple of books. And I always thought that there was another great idea out there like the library. It just didn't involve books, and I didn't know what that was. And then through, just circumstance, maybe some divine intervention, I found myself at Yad Sarah and was blown away. And my first thought was, wow, this is like a library. It just doesn't involve books. But I had really no idea what was going on in America. And my first call was to Adele Goldberg from Yad Sarah. And my first question is, what was going on here? And the answer is not a lot. I personally have no connection to durable medical equipment. We've been very fortunate in my immediate family. I don't think we've ever broken a bone. But what I see here based on the research that we've done is there's an opportunity to do three things that even if you could just do one of them, it would be great. But to do all three with one idea is, I think, really powerful. And the first thing is to meaningfully improve people's quality of life. And I've heard stories in this relatively short amount of time that I've been doing this that are just heartbreaking. And so you can really make a difference in people's lives. The second thing is you can measurably figure out what you're saving society. And when I say that, I mean Medicare, Medicaid, and individuals who have very high copays for this sort of equipment. A useless factoid that is not useless is that proportionally, the out-of-pocket expense for durable medical equipment is proportionally 4 times higher than the out-of-pocket expense for prescription drugs. So in America, so people talk about how they can't afford their drugs, and they're absolutely correct. But if you need durable medical equipment, the out-of-pocket in that space is 4 times higher, and that makes it inaccessible for a lot of people. And so that is kind of what I found here. And the third thing is that this is green, right? So we can improve people's lives. We can save society money in a very measurable way. And people don't know what to do with this stuff. Our experience is that people want this stuff out of their lives as quickly as possible, but they don't want to throw it out. And strangely, one of the strangest phenomenons to me in doing this for about a year now is that the people who borrow stuff are very appreciative, very thankful. The people who are donating stuff are even more thankful to not have to throw it out. And the first time somebody donated about 5 pieces of equipment worth probably between $5,000 and $10,000, and it was all new. And they were practically crying because they were so thankful to not have to throw this out. And I was thinking to myself, wow, this is a little bit strange. Somebody is giving us things of great value. That's definitely not the way things worked on Wall Street. And so, but then it happened again, and it happened again, and it happens almost every time. Mom would be so happy to know that somebody else can use this stuff, or dad would really be happy that this stuff didn't have to get thrown out. So that's been some of my experiences in this space.
So what exactly is Wheel It Forward, the name of your company?
Sure. So we haven't officially launched yet. I've been running this out of my garage for about a year. We've put together a great dedicated board of directors and board of advisors. And Wheel It Forward is basically a library that enables anyone to easily borrow or donate durable medical equipment at no cost. And we're going to see how it works. We're viewing ourselves as a startup. Startups by nature often start off as one thing and end up someplace else, and we'll be, you know, opportunistic and see where things go. But that's the idea, and it's been a challenge. One thing Adele mentioned to me in her first, in our first conversation, I said, "Why do you think there's not much going on in America?" And she immediately said, "You know, maybe we're a more litigious type of society." And of course, you know, being sued is the biggest risk I could name. And it took us about 6 months using 4 different insurance brokers to find an insurance policy, which ended up not being more expensive than we thought it would be, like we had budgeted for that amount. But, you know, if we were opening a barber shop, then we would fit into the barbershop bucket. But when you tell somebody in America that you're opening a durable medical equipment lending library, they're like, well, what's that? And they, you know, they have very little idea. And the truth is we don't totally know how this is going to play out. But the good news is we were able to solve that problem, and we hope to be able to solve a lot of the other issues that will undoubtedly come up over time.
We wish you a lot of luck in your efforts.
Thank you.
You're certainly providing a great service to the community.
Yad Sarah has gotten us.
You're unique. Yeah, I don't think there's another one in the United States. Am I correct?
So there's less than 10 places in the United States that are doing this in size. No two do the same thing. No two have the same best practices. Almost none of, there aren't more than 2 of them that have more than 1 location, which tells you, you know, how tight this stuff is.
Right, it is. Right.
Yeah.
Okay, let me get to Ellen. Ellen, do you want to respond to this question? Where did you find the lack of accessibility in your community? And what did you decide to do about it?
So I found the hardest lack of accessibility is in transportation. I'm thankful I have access to a wheelchair accessible vehicle, but there was a period of time that I didn't have access. It had broken down, had to be repaired, and I needed a way to get to work. So I called the local taxi company, and they did, thank God, have wheelchair accessible taxis, but they charged me double the price. So what I did about it is I actually took them to the Division of Human Rights and sued them and got my money back. And since then, they had to sign off an agreement that they will not charge any wheelchair users double the amount for a taxi ride.
They didn't know they were dealing with an attorney.
I guess not. I didn't mention that. That's right. The other thing I often find is, and this is the personal example, but a lot of lectures are also often given in inaccessible rooms. Like my shul was having a lecture, and our shul, thank God, is very big, but it was in a room that was not accessible. So I called up the rabbi who was in charge of the lecture, and he graciously moved it to an accessible room. And a lot of things are very easy in terms of accessibility to change. It's just that you have to be somewhat aware, and people have to realize, you know, oh, is someone with a wheelchair going to be here, or someone who can't use steps going to be here? Is this room accessible by an elevator? It's not always, you know, it doesn't always cost a lot to make things user-friendly or accessible.
And people aren't always aware of
Yes.
the needs of, right. Shani, any comments from you on the issue of accessibility?
Well, I've had a variety of interesting stories. I once had a group of bus drivers that I had to help them understand what it was like to be in a bus when a person isn't quite as quick as getting on and off a bus, not just with a wheelchair, but a senior or someone with a vision problem or someone with balance issues. So we took them on a ride, and we put them in very uncomfortable situations, and we found that now they are better bus drivers and more considerate. All of our drivers, the volunteers, as well as the paid drivers in our vans, go through courses about sensitivity and understanding. But the funniest issue, I think, is when I had the head of the Jerusalem Religious Council when they asked me why did a certain mikveh, a ritual bath area, why they were getting complaints. So when I put one of the gentlemen who had never been on a hoist from the ceiling in it and explained to him how it was hard for the helper, the balanit, which is the woman who is there, to shove someone over across the room, and that they had made some mistakes, he was much more sensitive to women's issues, as well as what's a reasonable approach and what's fair. We do a lot also giving people the opportunity to understand the law, but also how to deal with people who don't understand the law. And that has been quite fascinating for us.
Thank you. What's one moment that stands out to you where you really saw the impact of your work?
So there were several local disability organizations working to get a radiology office to get a patient transfer lift. It's difficult for a lot of people who aren't in wheelchairs, but it's even more difficult for a person in a wheelchair to get on an X-ray exam table. Often if they don't have the proper equipment, you have to be lifted, and that's not always so safe. So there had been a number of groups working on that issue, and it happened that I had to go to that specific office a few months later, and I was gratified to find out that they had indeed gotten a patient lift that successfully worked to help me get on the X-ray exam table.
Wow.
Nice.
That's quite a story. Wow. Anyone else? Shani? Elliot?
Elliot, why don't you go first?
Does
Okay.
any one moment stand out
Sure.
to you?
Sure. So when I started researching this space about 2 years ago, I spoke to a woman named Susan Mitchell, who runs a small lending closet in New Britain, Connecticut, because I figured I'd try to figure out what's going on in Connecticut first. And we had a nice conversation, and she said something to me that resonated, which was, you will never get more God bless yous than you will get than working at the front desk of one of these types of operations. And, you know, I remembered she said it, but then I started to actually do it. And it's pretty much every day in almost every encounter. And it's a little bit uncomfortable because people around here don't say God bless you a lot. I biked through the South, everyone there says God bless you for everything. One specific incident loan that we made out was about a week ago. I had been searching, we're trying to figure out whether if we go on Facebook Marketplace, Craigslist, Let Go, some of these other places, if when people are trying to sell stuff, reach out to them, say, we can't pay you cash for this, but this is what we're doing, and we could get you a tax receipt for it. We're fiscally sponsored by FJC, which is a wonderful organization, so that everything we're doing is tax deductible. This woman on Let Go, usually people are offering things that they want to sell. This woman had posted a question, does anybody have a hospital bed? And the post was about 2 weeks old, but I figured I've got 10 hospital beds in my garage, let me reach out. And so I reached out, and she wanted the hospital bed. And I explained to her just through a chat what we were doing. We're a new kind of library. Everything is free. You can make a suggested donation if you'd like. They pulled up to my house on a Friday. We gave them a hospital bed, bed railings, a brand new mattress, probably worth about $2,000. They have an 18-year-old son who has cerebral palsy, and Medicaid would not pay for a hospital bed for them. And they also wouldn't pay for a ramp. We gave them a wheelchair ramp, and we gave them a transport wheelchair. And the man who pulled up in a lawn, like a gardener's type of truck that had a trailer on the back, which was good because you could put a hospital bed onto that trailer. And before he left, he said, you know, you mentioned something about a donation. I'm going to come back tomorrow because tomorrow is Saturday and I get paid on Saturday and I'd like to make a donation. And I said to him, you're not coming back. But, and then later in the day, they sent me a picture of their son, Andrew, lying in the hospital bed. And it's that to me is barely a standout moment, because I could tell you 10 other stories like this, just as I'm sure Adele and Shani could tell you, and Ellen, very similar stories. But that is a recent story.
Thank you.
Wow.
Heartwarming. Shani, do you have?
I have every single day. I've been working
Every
for
day.
Yad Sarah for over 32 years. And
And it's hard
so
for you to
every
select
phone
one, right?
call, every phone call is a story. I can tell you the funny story of the person when I said to them, someone was in the hospital. They called, they were going to go home. They broke a hip, and there are people still in our hospitals here, regular people. And we gave them I sent them information about what we can offer, what they should ask the therapist, the whole, I'm new at this. I'm not sure what we need. A nice conversation. I sent by WhatsApp pictures to one person, email to another person, long conversation. And I said, well, how are you going to get your family member home? And they said, well, we're going to take them in and out of the car. And I said, well, they really can't walk very well, and they can't really transfer. And when I told them that the van could drive them, an accessible van could drive them from the hospital to the house, but on the way, because the person's been in the hospital for like a month and a half, they could take a little bit of a ride if the person wanted to, a little, I will say the outer ride of a park, or just to enjoy themselves.